Good evening, viewers. Welcome to this special live workshop in honor of World Polio Day. Today, we will be addressing some of the common concerns that parents have related to polio vaccine for children in the age group of 6 weeks to 6 years. That is, 6, 10, and 14 weeks, 16 to 18 months, and 4 to 6 years. World Polio Day is a day to celebrate how far we have come in the fight against this debilitating and deadly disease that has claimed so many lives over the years. It is also important to emphasize on the importance of raising awareness and getting our children vaccinated. Polio or poliomyelitis is an infectious disease that has been responsible for causing paralysis in hundreds and thousands of children over the globe for years. The disease can manifest in many ways, but it majorly affects children below the age of 5. The development of polio vaccines in the 20th century was a major breakthrough that has helped to lower the incidence of polio by almost 99%. However, the disease has not yet been eradicated, and this is the reason why parents need to be more vigilant, especially when it comes to getting their children vaccinated. For this workshop, we are privileged to have Dr. Hemendra Gupta, consulting pediatrician neonatologist at Dr. Hemendra Gupta's Child Care Center, Jaipur, who has joined us to shed light on the importance of polio vaccination and children. Dr. Hemendra Gupta has over 20 years of experience and specializes in growth and development, vaccination and immunization, pediatric nutrition, and bronchial asthma treatment. Dr. Hemendra, thank you for joining us today.
Thank you.
What message would you like to share with parents on the occasion of World Polio Day?
First of all, I would like to thank all of you for joining this session, as this is a very important session as it's about polio, that is a very crippling and deadly disease. I would
It's a
like to
pleasure.
request all the parents on this occasion of World Polio Day that they must vaccinate their child against polio, as it's a very deadly and crippling disease. And the vaccination is the only tool by which we can safeguard our children. We are near the verge of eradicating this disease from the world. Till date, the only disease that has been eradicated from the world is smallpox, and it was eradicated in 1977. But we are very near, we are very closer to eradicate this disease also. But it can be possible only by vaccination. By vaccinating your child, you are not safeguarding your children, but you are contributing to a world that is free from polio. And it will be a wonderful gift for upcoming generations. So let's stay and committed together in this fight against polio. Together we can make a difference. But I
Surely,
would like to say something about polio also.
sure.
Polio virus is basically a RNA virus, and there are three types of polio viruses: type 1, type 2, and type 3. In 1988, there were around 125 countries that were endemic for wild polio virus. And at that time, we were encountering around 350,000 paralytic polio cases annually. And this number was quite huge. Seeing this huge number, a global initiative for polio eradication was launched by World Health Organization. And this program has got huge impact in the reduction of polio cases. So in 2022, there were only 5.96 wild poliovirus cases in the world. Means there was 99.9% reduction in the polio cases. So you can see the impact of vaccination. We were able to reduce the polio cases by 99.9%. It's quite huge. Uh, Poliovirus type 2 and type 3 has already been eradicated from the world, and only the type 1 is remaining. And I would like to congratulate all of you that India has been declared as wild poliovirus free by World Health Organization in 2014. and I am very feeling very proud to say that India is one of the 11 countries in the southeast region that has been certified as wild poliovirus free. So again, I would like to request all of you to please vaccinate your child against this polio, as this is very deadly, very crippling, and it's necessary to keep this world free from polio. Thank you.
Thank you so much, doctor, and thank you for sharing this wonderful news. So, I'm sure that parents are going to find this really informative. Before we jump into the questions, I would like to welcome parents on this workshop once again. During this workshop, Dr. Hemendra will be answering your questions live to help clarify any doubts that you have regarding the polio vaccination. So, feel free to ask any question in the comments. So, Dr. Hemendra, my first question to you is, how effective is the polio vaccine?
Polio is a very crippling disease, and in today's scenario, we are having two tools to protect our kids against polio. And this is polio vaccine. There are two types of polio vaccines. One is oral polio vaccine. It is given in the form of oral drop, and other one is injectable polio vaccine. It is given in the form of injection. Both the vaccines are quite effective. Oral vaccines are particularly used in the scenario where the wild polio transmission is there. It's very good in inducing intestinal immunity as well as in systemic immunity. As far as efficacy of this vaccine is concerned, it's around 95% efficacious after completing the whole schedule of this vaccine. And while we talk about injectable polio vaccine, it's very good vaccine. It's very good in inducing systemic immunity, and it's provide around 99 to 100% efficacy after completing the whole schedule.
So, now that we have talked about the effectiveness of polio vaccine, let's come to the safety part. How safe is the vaccine, and what are the potential side effects that parents need to know about?
Let's see. These both these vaccines are quite safe. Both of these vaccines are approved by WHO, means World Health Organization, and CDC, that is Center for Disease Control Atlanta. Why we are so sure that these vaccines are safe? Because these vaccines are used globally, and we are having huge data of their safety. Uh, all these vaccines comes in the market after rigorous testing, and these vaccines are used since decades. These, the injectable polio vaccine was invented in 1955, and the oral polio vaccine was invented in 1961. Since then, we are using these vaccines. So we can say that these vaccines are completely safe. But as we all know, no medicine has got only effect and not having any side effect. This is also true for polio vaccine. Both of these vaccines have got certain side effects. When we are talking about oral polio vaccine, it may have certain local side effects like it may cause GI disturbances in form of nausea, vomiting, diarrhea. But
Okay.
yes, there is one very serious side effect of this oral polio vaccine is VOPP. That is called vaccine-associated paralytic polio. Sometimes this virus gets genetically changed inside the body of a recipient of this vaccine and causes polio. Though the chances are quite rare, it's around 1 in 2.7 million cases, but yes, it's still there. When we talk about the side effect of injectable polio vaccine, they may be like redness at the vaccination site, mild pain, fever, headache, and in very rare cases, it may lead to anaphylactic reactions also. But usually, when we talk about benefits, the benefits are much more higher as compared to side effects. So do not hesitate. It's better to go for vaccination for your kids. Complete your kids' vaccination on time and all the dose.
Thank you, doctor. This information really helps the parents who are watching this live session. There are some more questions that I would like to ask you, but before we continue, I would want to let the parents know that we are taking questions in this live. If you have any queries, please feel free to ask them, and Dr. Hemendra will try to answer as many as possible in this session. So let's start with the next question. Is polio an infectious disease?
Yes, definitely it's infectious disease. The mode of transmission of polio is fecal-oral and oro-oral. Means a person gets polio by consuming infected water and food. So it's infectious disease, definitely.
Okay. Uh, so is it a contagious disease? Like, can it spread from one person to another?
Yes, it can spread from one person to another person. Suppose a person is residing with a close contact of the polio, and if or she is consuming the same food or same water that the infected person is consuming, then there are chances of developing polio.
Okay. So what are the
Sometimes
yeah.
the disease may spread by respiratory droplets also. Or sometimes a person if sometimes if a person comes in contact with surface that is
Yeah.
contaminated by infected person's food or water, then it may lead to polio also.
Okay. So what are the primary risk factors that can increase the chances of polio?
As we all know that the mode of transmission of this disease is fecal-oral. Means a person, if he or she is consuming infected water or food, then there are chances of developing polio. So the poor sanitation or hygiene is a major risk factor for developing polio. Besides this, there are certain other factors that increases the chances of developing polio, and these are lack of immunization, means if your child is not receiving polio vaccine, if you are traveling to a country uh, or living in a country that is endemic to polio, if your child is of younger age, because the immune system of these kids are in developing phase, if if your child, if you are residing with close contact of infected person, means the person having polio, and if your child is suffering from some immune deficiency disorder, then there are high chances of developing polio. And if your child is malnutrition, because the immune system in these type of kids are not properly developed, so there are chances of developing polio in these kids as compared to normal.
Okay, thank you, doctor. So the next question is, when should a baby be given the first polio vaccine?
Basically, there are two types of immunization program in India. One is universal program of immunization that is from government of India. As per this program, zero dose of polio vaccine is given at birth or as soon as after birth, and the first dose is given at 6 weeks of age. As far as Indian Academy of Pediatrics is concerned, IAP recommends zero dose of oral polio vaccine at birth. At 6 weeks, Indian Academy of Pediatrics do not recommend OPV. Instead of giving oral polio vaccine, Indian Academy of Pediatrics recommend giving injectable polio vaccine.
Okay, so does a 5-year-old child also need polio vaccination?
Yes, a 5-year-old child, uh, boy or girl, must need a polio vaccine because as the age advances, the immunity against this polio vaccine begins to fall. So to boost that immunity, it is necessary to give the booster doses of polio vaccine at this age.
Okay. So when can parents stop giving the booster dose? What's the right age for it?
If if your child has received all the doses of polio vaccine, means zero dose at birth, then 6, 10, 14 weeks dosage, and first booster at 18 months, then second booster at 4 to 6 years of age, then there is no need of giving any polio vaccine after receiving second booster, means after 4 to 6 years of age.
Okay. So at what age should the first booster dose be given?
First booster dose of oral polio vaccine is given at the age of 16 to 18 months, but we are not strict to this. Suppose a child who is around 3 year old comes to us for first booster of polio vaccine, then we should not deny for giving this booster to that child. So we can give first booster to a child up to the age of 4 years.
So, what steps can parents take to protect their infants from polio?
There are certain measures which can be taken to safeguard our children. The first and most important thing is to keep your child vaccination up to date. It's very important to have all the polio vaccination on time at proper age. Secondly, you must maintain proper hygiene. You must have access to clean potable water. You must be informed about the risk of the diseases, and you must attend all the pulse polio days that are being organized by Government of India time to time. Besides this, Government of India is organizing these days are called as Pulse Polio Days, and these are quite familiar among us. Besides this, Government of India is organizing mopping days. And what are these mopping days? In these days, a person we all see that a person comes visit home to home to vaccinate all the children against polio who are less than 5 years of age. This person comes again after 6 weeks to vaccinate that particular child. And lastly, it's better to visit your pediatrician time to time as he is the right person, he or she is the right person to take care of your kids' health.
Okay, doctor. So, like small children, they can go out, but babies are mostly inside the home and in the care of the parents. So, why is it important for babies to get vaccinated?
It's very important to get vaccination against polio because, as we all know, it's very crippling, very debilitating disease. Though the chances of developing polio is around 0.5%, uh, but it's there. Once a child gets polio, then the debility may be permanent. Secondly, sometimes the polio virus affects respiratory muscles and causes respiratory paralysis that may lead to death. Thirdly, it's very important to prevent spread of the disease, and vaccination is a very effective tool to prevent the spread of the disease. Fourthly, it's our duty, it's our global duty to eradicate the disease from the world, and it's only possible by the vaccination. Fifthly, sometimes, in few cases, the polio may lead to post-polio syndrome. And what is post-polio syndrome? In some kids who develop polio, in future they may get muscle aches, pain, fever, fatigue. This is called post-polio syndrome. So by vaccinating our kids, we can avoid this developing or developing this post-polio syndrome. And last thing, by vaccinating our kids, we are not only safeguarding our children, but we are also contributing to make a world that is polluted.
So, doctor, how many polio vaccines does a child need in the first year, like after birth?
Uh, this is again differences. There are difference in the doses of polio vaccine schedule. Basically, universal program for immunization is different from program of Indian Academy of Pediatrics. Firstly, I am talking about UIP, that is Universal Immunization Program. As per this program, we are giving zero dose of polio at birth. Then we are giving oral polio at 6, 10, and 14 weeks. But in UIP, we are also giving fractional dose of IPV at 6 weeks and 14 weeks. And what is fractional dose? We are giving 0.1 ml of intradermal dose of this injectable polio vaccine, that is called fractional dose. Then at 9 months, we are providing oral polio dose again in UIP. Now I am talking about Indian Academy of Pediatrics schedule. As per IFA schedule, we are offering zero dose oral polio vaccine at birth. Then at 6, 10, 14 weeks, we are introducing injectable polio vaccine to our kids.
Thank you so much, doctor. We now have some questions from the parents. So let's start with the first question. It's from Ashwin. I've heard that polio drops are better, but my husband thinks we should opt for vaccines for our baby girl. Really confused between the two. Can you please help?
We can't say that any one vaccine is better than other. Both the vaccines have got individual characteristics, individual peculiarities. When we are talking about oral polio vaccine, this vaccine is particularly important in scenarios where wild polio transmission is there. It's excellent in providing intestinal immunity as well as systemic immunity. But we cannot offer this vaccine to a person whose immune system is not working properly. While we are talking about injectable polio vaccine, if this vaccine is excellent in providing systemic immunity, but this vaccine is not providing intestinal immunity, but it means that this vaccine has got no impact on herd immunity. But this vaccine is excellent in providing uh, uh, individual immunity. So we cannot say that any particular vaccine is better than other. It's better to go for both these vaccines. So IAP also recommends giving oral polio at birth, then followed by injectable polio vaccine doses at 6 weeks, 10 weeks, and 14 weeks.
Thank you so much, doctor, for sharing the information. Now, the next question is, my 3-year-old missed her last vaccine and I'm really worried. Does this mean that she can have polio? I'm a single mom and I really don't know what to do. The question is from Surbhi.
See, if your child has received all the doses before 3 years, then then there are very negligible chances of developing polio. In this case, I would suggest you to go to your pediatrician and complete the rest of the immunization program for your child.
Um, Thank you, doctor. Now, the next question is, my aunt told me that polio vaccines work only if a baby becomes feverish after getting the dose. My son did not get fever last time. Does that mean it did not work?
It's a myth. It's a myth, 100% myth, and it's quite prevalent in Indian society. It's not like that. It doesn't mean that having fever is a certificate for having proper immunization. Nowadays, there are very improved vaccines that leads to minimal side effects. It doesn't mean that they they don't work. They are they will work 100%. So have trust on your doctor and vaccinate yourself.
Thank you for the answer, doctor. Now, the next question is from Yuvika. My son is about to turn 5 and I still get him vaccinated, but my mother in law keeps telling me that there is no need as the first dose is enough. Can you please tell me whether it is
No,
safe?
no, 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 no. I would like to suggest you that it's better to complete the whole vaccination schedule. You have already given first booster to your child, and it's time for second booster. As we all know that the age passes, the immune titers of that particular vaccine decreases with age. So to boost the immunity, it's better to get the booster dose, to get the second booster of this vaccine given to your child.
Okay. So, next question is from Samiksha. Hello. How to keep
Uh,
track of the pulse polio schedule? I don't have any idea and I missed my baby's first pulse polio.
you don't worry about that because the oral polio vaccine has got a wonderful effect that is called hard effect. Suppose 100 kids are there in your family and 100 kids are there in your community and 80 out of 100 receive this oral polio vaccine. So, so what happens in this case? These 80 patients shed the live attenuated virus in their stool. This virus goes in the environment and provides immunity to get remaining 20 kids in your community. So this is called hard effect. So you need not to worry about that. Your child still get vaccinated even if he or she has not received this first polio dose.
Thank you for sharing the answer. Next question is from Ruby. Is it safe to give the polio vaccine along with other routine vaccinations?
Yes, it's 100% safe to have this polio vaccine along with other vaccines. There are no side effects and there are no contraindications for respecting other vaccine users along with oral polio vaccine. But
Uh,
take care if your child is immunocompromised or suffering from certain diseases make which makes him or immunocompromised that he or she is on steroids. and it's better to avoid this oral polio.
Thank you, doctor. Next question is from Ruby. Sorry, it's from Shruti. सर, प्रेग्नेंट लेडी वैक्सीन ले सकती है बच्चे की सुरक्षा के लिए?
What vaccine?
पोलियो
There
वैक्सीन.
are there, no, polio vaccine is not meant for pregnant ladies. There are certain vaccines that are meant for pregnant ladies, and these are tetanus toxoid, other one is Tdap, means tetanus diphtheria pertussis vaccine, and the third one is flu vaccine. These vaccines are recommended by COPSI for a pregnant lady, not polio vaccine.
Okay. So, are polio drops more effective than the vaccine?
We cannot say like this. Both the vaccines are important, both the vaccines are efficacious. When we talk about efficacy of oral polio, it's around 95% efficacious, and injectable polio vaccine around 99 to 100% efficacious. So both the vaccines are good, both the vaccines are important.
Okay. So, next question is from Deepika. Do extra vaccinations guarantee extra protection? My child has already got his vaccination, but I want to continue the doses to be sure.
No, there is no need of giving extra doses of polio vaccine. Please don't take this, as in certain cases, this live virus gets activated inside the body and may lead to VACP, that is vaccine-associated paralytic polio. So there is no need of giving polio vaccine after the age of 5 years. No need of extra doses.
Okay. So, next question is from Akhil. Hello, doctor. My son is about to start school next year. His school says polio vaccine is mandatory for school entry, but he didn't get his booster dose. Can I get it now? What can I do?
If your child age is less than 5 to 6 years, then definitely he can receive this vaccine. You need not to worry about it.
Okay.
After 6 years, then it's not recommended.
Okay, doctor. So the next question is from Sandhya. I recently came across an article about vaccine derived polio. Does it mean that the vaccine can cause polio too?
In certain cases, yes, it can cause, but the chances are quite rare. It's around 2 to 4 per 2 to 4 million cases. And what is this vaccine-derived polio? Basically, in certain cases, this virus gets reactivated, or we can say that it reacquires the capacity to regenerate or to affect the skin.
Okay. So, doctor, next question is from Abhishek. We are often traveling around for work, which makes it difficult to follow the schedule. Luckily, we did not miss the first and second dose, but it's been a close call. Is there any other way to ensure our son's safety if he misses a booster dose?
In this case, if your child is less than 6 years of age, then it's better to complete the vaccination schedule of your child by giving him second booster of this oral polio vaccine. That's it.
So, our next question is from Jyoti. What if my child has a weakened immune system? Can they still get vaccinated?
Yes, definitely. Uh, in this case, we are having injectable polio vaccine, and it's made from killed polio virus, and it's 100% safe for these types of kids. So mm, he may complete the schedule with this injectable polio vaccine at 6 weeks, 10 weeks, 14 weeks. First booster at 18 months, and second booster at around 4 to 5 years of age.
So, doctor, is there any chance that a child can get polio even after getting vaccinated?
Uh, no, in this question, I want to say that there is no vaccine that is 100% efficacy. The efficacy is around uh, 99%. So there are still chances of developing polio even after vaccination, but the chances are quite rare. So trust on the vaccine.
So, if we have someone in the family who has polio, some elder person, so can we allow our kids to go near them? Is it safe?
Uh, no, it's not safe to remain in the close contact with the person who is having polio, who is acute case of polio. Suppose a person who is having polio since 15 to 20 years, and your child is playing with that person, then it's 100% safe. In that case, he or she will not be able to transmit the disease.
Okay, doctor. So, uh, like we all know about the pulse polio campaigns, and many people like they miss it because of work or any other stuff. So, is there any standard protocol that is to be followed in such cases, like if parents miss a dose?
In that case, you need not to worry about it. Basically, Pulse Polio campaign has got certain mottos. Pulse polio campaigns are organized to induce herd immunity in the community. Basically. So I have already told you that the basic motto of pulse polio campaigns are to break the transmission chain of wild polio virus. So in these pulse polio campaigns, we are trying to vaccinate as much of as kids possible on the single day. So to provide herd effect in the community. So the remaining kids which have not received the vaccine on that particular day gets automatically immunity from these kids who have received this first polio dose.
Okay, thank you, doctor. So, the next question is, can my child receive the polio vaccine if they have had COVID-19?
Yes, it's 100% safe to have vaccine even if your child had COVID.
Okay, doctor. So, like, what else do you want to like tell the parents about polio? Like, they shouldn't miss the dose we have talked about. So, we have discussed so many questions around. So, what else would you like to suggest the parents related to
I
this
would like
disease?
to I would like to suggest you that there is no need to worry if you have missed your child vaccination doses. Consult with your pediatrician. Take your vaccination chart with you. Show this card to your pediatrician. Or so he is the right person to guide you about the vaccination schedule of your child. Uh, it's it's nothing strict if you have missed first or second booster. So if your child age is appropriate, then he will definitely give first booster as well as second booster to your child.
Okay. So next question is from Kushal, who's asking what to do if baby has cough and cold on the vaccination date. My baby keeps getting sick, so I want to make sure that he doesn't get the side effects.
Minor illnesses are never a contraindication for any vaccine. So if your child is suffering from minor cough and cold or suppose mild fever, then there is no need to worry about it. You may go for vaccination for your child.
Okay, thank you so much, doctor. So as we were discussing about polio, like we know that there's paralysis, which is a major symptom of polio, major like
Mm.
thing which is associated with it. But what other symptoms are there? Is it like there is some intensity, ki mild and then moderate and then severe cases where they have
No, no,
paralysis?
no.
Okay.
There is no grading of polio basically. We can't say that it's mild, moderate, or severe.
Okay.
Basically, it affects the anterior horn cell and causes motor weakness in the body. In rare cases, it may affect the respiratory muscles, causes paralysis of respiration, and may lead to death also. And it's fatal.
Okay. So we have a question from Deeksha. Is it safe for my child to receive multiple vaccines at once, including the polio vaccine?
Yes, it's very safe to have all the vaccine at one shot. Nowadays, we are having combination vaccines. Means we are giving diphtheria, pertussis, tetanus, HIV vaccine, IPV, and hepatitis B in a single shot. So the number of injections are quite less. These are only two. Uh, so it's it's safe to have all the vaccines on single day.
Okay. So, next question is from Jayati, who's asking, my baby is a preterm baby. Should he also receive the polio vaccine as per the normal schedule, or is it
Yes,
different for premature babies?
no, it's same for premature babies. Uh, I would like to say that the premature baby must not receive hepatitis B vaccine if the weight of the baby is less than 2 kg. It's only for hepatitis B, not for polio vaccine. So if your baby is premature, then definitely go for polio vaccine as per schedule. No need to skip the dose.
So, the polio vaccines that are given to the children, they offer lifelong protection. Like later in life, they can't develop polio even after coming in contact with people, right?
Yes,
So, there is no possibility.
no. It provides
Okay.
lifelong protection.
Okay, so it's a lifelong protection. So that is why it's very important to get vaccinated, parents. So,
Yes, yes, yes.
next question is from Amira. Should underweight babies receive the polio vaccine or is it advisable to wait?
No, we should not do it. I have already told you that it's only for hepatitis B vaccine, as their immune system is not appropriate to develop adequate antibody titers against hepatitis B, but it's not for polio. So it's safe to give for polio vaccine for underweight babies or premature babies.
So, doctor, is polio genetic? Can it be like parents ko
No,
tha? Yeah.
it's not a genetic disease. It's acquired disease, and the mode of transmission is fecal.
Okay, so this means that if someone in the family has had it in the past, so the child or nobody is at the risk, right?
No, no.
Okay. So next question is from कमला. It's मेरे बच्चे को पोलियो वैक्सीन करने के बाद पेट दर्द हुआ, क्या ऐसा होना चाहिए?
देखिए पोलियो वैक्सीन के ओरल पोलियो वैक्सीन के सर्टेन साइड इफेक्ट होते हैं मैंने बताया जैसे पहले भी आपको दीज आर
जी.
माइल्डर साइड इफेक्ट एंड मे बी इट मे बी इन द फॉर्म ऑफ nausea, vomiting, mild loose motions, pain abdomen, mild fever, irritability, etc. So it's quite normal. Nothing to worry about.
Okay. So doctor, in such cases where the child is experiencing these symptoms, is it important to consult a doctor or are there any specific symptoms for which we need to consult, like parents need to watch out for?
If your child is feeling weakness after vaccination, if you are seeing that your child is not able to move his limbs, then it's better to consult with your doctor. Because in certain cases, there are chances of developing VAP, that is vaccine associated therapy polio, after receiving within 60 days of receiving this polio vaccine.
Okay, doctor. So is it important to get the booster dose?
Yes, it's very necessary to get all the doses, including booster doses, to your kid. As the age advances, the antibody titers begins to fall. So your child may not be protected well for polio. So so to boost the immunity, it's better to get the booster doses.
Okay. So, as you said, there are two types of vaccines. So, what if both the vaccines are given? Will it offer any added protection to the baby, or is it not safe to give both?
It's very safe to receive both the vaccine, and Indian Academy of Pediatrics strongly recommend giving oral polio vaccine at birth, followed by injectable polio vaccine at 6 weeks, 10 weeks, and 14 weeks. This schedule means OPV followed by injectable polio vaccine introduces a robust immune response in a kid. This induces very good titer of mucosal immunity as well as systemic immunity. So this is wonderful schedule OPV followed by injectable polio vaccine.
So, next question is from Deepika. If a baby had pneumonia at birth, should they also get the vaccine as scheduled?
Yes, it's safe to. give polio vaccine if your child had pneumonia at birth.
Okay.
But if
So,
or she is
okay.
immunocompromised that leads to pneumonia, then in that case, let your pediatrician decide about that.
Okay. So, if a parent has not received polio vaccination as a child, does it increase the chances of the baby developing it?
No,
Okay. There's no relation between the two.
no.
Okay. So, how to spot polio signs early in a kid? This question has been asked by Sudiksha.
I'm not getting this question. What is the question?
Signs
Please
early
repeat the
in a
question.
kid. How to spot polio signs early in a kid?
How?
To spot polio signs early in a kid. She's basically asking
Okay,
about
okay.
early
Signs
signs.
of polio. Signs of
Yeah,
polio.
yeah.
There are certain signs if a child is about to develop polio means he or she may have fever, weakness, decreased movements of limbs, and sometimes aches in the muscles. These are certain signs of polio.
Thank you for answering, Doctor. So, as we are about to conclude this session, I would like you to share some insights and summarize the whole session. What would you like to tell the parents? Any suggestions that you would want to give them?
As we all know that this disease is very crippling. When we were doing MBBS, we means in 1994, first polio campaigns were started in India. At that time, we were encountering lots of cases of erratic polio in the country. But since the introduction of this oral polio vaccine in pulse polio campaigns, there are huge reduction in the number of cases of this polio. It was very debilitating, very crippling. Once we see the cases of polio, and it's very disheartening to see these type of patients. So it's our moral duty and social duty also to get vaccinated our children against this deadly disease to make this world polio free. It will be a wonderful gift for our future generations to come.
Thank you so much, Doctor. It was an honor to have you here. Thank you for sharing such wonderful
Thank
insights
you.
with the parents, and I'm sure they're going to benefit from it. So, thank you, viewers, for joining us today for this workshop.
Thank you.
Okay.